KiwiCo projects are designed to spark creativity, tinkering, and learning in kids of all ages. They make learning about STEAM fun. They're on a mission to empower kids, not just to make a project, but to make a difference. KiwiCo is offering Parenting Great Kids podcast listeners the chance to try them for free. To redeem this offer and learn more about their projects for kids of all ages, visit KiwiCo.com/Meg. TeenCounseling.com connects your 13 to 19-year-old with a licensed professional counselor right where they spend most of their time, on their smartphone. Simply complete a short questionnaire and you'll be matched with a skilled therapist in TeenCounseling.com's network of specialists. Then, once you review their credentials and approve, the counselor and your teen will begin communicating directly. Visit teencounseling.com/Meg and help your teen take charge of their mental health. Parenting Great Kids listeners can get 10% off your first month at teencounseling.com/Meg. For 30 plus years, I've seen every type of child grow up.
Instead of giving me what I wanted, she gave me what I needed, which was truth.
Don't let emotions win. Let truth win.
Do your very best, and you should have a lot of fun while you do it. And the better you get at something, the more fun you're going to have at something.
You moms and dads are wired with everything you need to be a parent to a great kid. Welcome to Parenting Great Kids. This is episode number 86, and I'm your host, Dr. Meg Meeker. Our subject this episode is dealing with migraine headaches. I have two guests joining me today for this interview. The first is Keith DiMarino, who as a parent has gone through a very difficult time as his daughter Alexa dealt with severe migraine headaches. You'll hear Keith share his story about his daughter Alexa, but first, let me tell you a little bit about Keith. Keith is the CEO at DocuVault, one of the nation's fastest growing archive storage management businesses in West Deptford, New Jersey. He received his BA in entrepreneurial management from the Wharton School of the University of Pennsylvania. Since then, he's become an avid student of marketing, product positioning, lead generation, business growth, finance, and the sales process. Outside of work, Keith coaches multiple community sports teams. He completed the Rim to Rim to Rim challenge, covering more than 48 miles in the Grand Canyon to raise awareness and money for pediatric migraines after his daughter was diagnosed with this condition in 2018. Keith lives in Wayne, Pennsylvania with his wife, Jennifer, and 4 kids. Also joining us today is Dr. Donna Stephenson. Donna is an attending physician and medical director of operations and outreach for the Division of Neurology at Children's Hospital of Philadelphia. She received her MD at Johns Hopkins University School of Medicine in Baltimore, Maryland. As always, I'll share my points to ponder for you to start using right away. And remember, don't just download episodes, click subscribe, because when you do that, you are joining my parenting revolution, and each new episode will automatically show up in your subscribed list. I'd love for you also to write a review on iTunes and let us know what you think of the podcast. We're not only on iTunes, but the Parenting Great Kids podcast is also available in the Google Play Store and on Stitcher. So no matter where you get your podcast, subscribe today and don't miss a single episode. So parents, thanks for listening. This is episode number 86. Stay with us. I want you now to listen in on a conversation I had with Keith DiMarino and Dr. Donna Stephenson. I know you're really going to enjoy it. Well, Dr. Stephenson and Keith, thank you so much for joining me today on our podcast to talk about migraines and kids.
Thanks. It's great to be here.
Keith, let me ask you, you raised a lot of money for migraine awareness, $25,000, I believe, and you did so by running the Rim to Rim in the Grand Canyon. Can you tell me how that all began and why you decided to raise that much money?
We had a challenging situation with my daughter, Alexa, and she was getting migraine headaches. And around the same time, a friend had asked me if I wanted to do kind of like an extreme challenge, and I felt that was way out of my league. But then I watched my daughter, who was also kind of felt like she was out of her league with her headaches. Mm-hmm. And I thought, well, maybe I could do this together, where we raised money for CHOP and their pediatric migraine program, as well as awareness for her condition. And I would challenge myself just as much as she would be challenging herself. So that was the basis of the event, and we were able to do the rim to rim and raise money for CHOP at the same time.
Can you tell us a little bit about what a lot of people don't know what rim to rim? Did you do rim to rim or rim to rim to rim?
Very important. You have to know the difference, because
yes,
you're going to sell somebody short if you just have one. It's actually the rim to rim to rim, and it's the south rim. You start on the south rim of the Grand Canyon. You go down the rim, and then you go across the valley, across the Colorado River, and then you go back up the north end of the Grand Canyon. You sleep overnight, and then the next morning you wake up and do it all in reverse again. And the elevation's tough. It's about a 10,000 feet elevation each day, with a 24-mile across each day.
So total miles was?
48.
Oh, and that's up and down and up and down. It sounds miserable to me. Tell me, what kind of symptoms was your daughter having? And how long had she had them, and how old was she when you realized these headaches are not normal headaches?
Right. She was 12, and she had 100 days of a migraine headache straight. And we started to see, we thought it was just a sinus infection, and then it kind of continued, and we thought maybe allergies, and then we didn't really know what to do at that point. And then we went to various places to try and diagnose her, and we were relatively unsuccessful. We did arrive at CHOP under Dr. Stephenson's care, and were able to kind of assess what was going on and provide some relief. And over time, the headache had subsided, and that's probably about, I'd say, into the 4th month for her.
And how old's your daughter now?
She's 13 now. Okay.
And when did her migraine start?
Well, that migraine was specific to her, that in her 12 years, that was specific to her, with it being constant. But, I think she probably had migraines here and there, over the years, but nothing as severe. So as a parent, it's kind of hard to diagnose. Is it just a headache, or is it a migraine? And so she probably had them for a good portion of her life, but off and on briefly.
What kind of symptoms was she having?
Well, she'd have a headache. She'd have a sensitivity to bright lights, sounds and noises. The headache would move to the different parts of her head. Really tight shoulders and neck. Everything nausea, everything that kind of comes with migraine, she had it at some point.
Well, the reason I'm asking is because there are a lot of parents listening to our podcast whose kids have headaches. And it's hard often for parents to know, is this a headache that I should take seriously? Is it most people know the word migraine, and they think, well, that migraine's just a severe headache. But in truth, migraines are very different from other kinds of headaches. So, as a parent, you thought at first, well, she's just having bad headaches. We don't know what's happening. Did you first go to your pediatrician? Where did you start in your journey to figure out what this was?
We did start with a pediatrician, and we found really it wasn't not an effective meeting. And then we went to a couple of different programs. Now, we have some experience with migraine because it is in the family. My wife has experienced them as well as her mom. And so we know, a lot about them, and we know triggers, and we kind of understand probably more than most what it looks like. So we were quickly jumping on that and moved towards, I would say we were more aggressive once we kind of felt like we knew it was migraine.
I will tell you, my experience as a pediatrician is that when a parent has a child with some kind of illness, parents become experts in that illness, because they read and read and read. And so I'm sure you know quite a lot about migraines. Dr. Stephenson, you're a neurologist. You work at Children's Hospital Pennsylvania. You've seen a lot of kids with migraines. What percent of kids, or what's the prevalence of migraines in kids in the country?
So that's a great question. And we have a lot of data to suggest that headache is much more common than we think in children. It turns out that in multiple studies, between 30 and 50% of children by the age of 12 will have had repeated headaches. So that's a really high percentage. Now, less than 10% of those will be migraine headaches, but the incidence of migraine headaches increases gradually with age, really starts to become much more of a problem during adolescence, especially in girls.
Yeah. Do you think that's related to puberty hormones?
I think probably so. We definitely see that there is an association of increased migraine triggering through around the time of your menstrual cycle.
I asked that as a migraine sufferer, and I know I didn't get migraines until around puberty, but I certainly see kids with migraines before that. Will you explain to us, Dr. Stephenson, the difference between a migraine headache and a non-migraine headache?
Sure. So the headache in general can be distinguished, can be divided into either a primary headache disorder where the headache is the problem, or a headache is a sign of an underlying problem. Now, thankfully, the latter is very rare. Headaches are rarely due to something sinister like a brain tumor or an aneurysm, and they're most likely to be a primary headache. The two main types of primary headache are tension type headaches, which is the general stress headache that people get. So that is a mild to moderate headache that is not worsened by activity and doesn't have any of the other migraine features that we'll talk about. A migraine headache is distinguished largely by how severe it is. It is a moderate to severe intensity headache that often has a throbbing quality. It can be anywhere in the head, and often in children is in the forehead. It can last from 2 to 72 hours and is almost always associated with at least a few of light sensitivity, loud noise sensitivity, nausea, vomiting, and it gets worse with exertion.
So really what you're talking about, because parents are often, how do I know the difference between a migraine and a regular headache? Throbbing. Do kids always have throbbing or that sense? I ask kids, do you feel like there's a hammer in your head? Do you see kids with migraines who don't have throbbing?
Yes. And so kids can use all different sorts of words to describe their headache. And I would say squeezing headaches or pressure headaches can also be a sign of migraine. It almost is the severity and how much the headache limits your activities that will define a migraine in childhood. So if a headache lands a child up on the couch, unable to watch TV, a sick headache, in air quotes, then I think of that as much more of a migraine than a tension type headache where most kids can muddle through their activities.
Yeah. My next question is for Keith. Now, Keith, when your daughter first started having headaches, how did she were they disabling? I mean, were there that 100 days, was she able to function, go to school, or was there a point where she said, I can't function?
She was, in the beginning, she was doing both, and you could see that it was exhausting for her. And then not more than 3 or 4 days in, it was just so bad that she just had to stay in her room and in bed. So it was debilitating to the extent that she couldn't finish school. She just had to stay home. And for most of the time, she was in a dark room, and it was very sad as a parent to watch her go through that.
Yeah. Did you try any remedies, non-traditional? Did your pediatrician give you any medications to try? Where did you start in trying to help her?
Well, we did try the non-traditional, I guess you'd say the basic remedies, which was the Tylenol or, if it was sinus related, we were, there was a neti pots and there was, take a warm shower and things like that. And those proved to have no effect on the migraine. Since my wife has had a history of this, we kind of also know that you can go the wrong direction with some of these remedies. People would say take Excedrin migraine or drink a lot of caffeine or, and some of those things are strongly advised against. And Dr. Stephenson can comment, but no, we stayed away from them because we knew that wasn't the approach. In migraine, the challenge has always been finding the right medicine and then how long does it take for the medicine to work?
Yeah.
That's kind of our challenge. We started on 1, 2, and 3 different kinds of medicine. None of them worked. And then you have to start all over again.
Which were the first 2 or 3 that you tried, that your doctor had told you to try? I assume they're prescription medications.
Topamax was one of them for, I guess, the kid version. Depakote was one. And there were a few others. Do you remember, Doctor?
Yeah, I think per her records, and I wasn't the treating physician at that time, but she tried Elavil and then a whole lot of medications in the hospital that were given to her by IV in an attempt to really break this headache.
And none of them worked, correct, Keith?
Well, the emergency room has protocols, and they would make her feel a little better. So if she went in with a 9 headache out of 10, she'd walk out with a 3. But then within 24 hours, she was back at an 8 or 9 again. And and we did that for 3 or 4 times. And sometimes that medicine's helpful, but for her, it really didn't break the sequence.
Well, in my experience, and Dr. Stephenson, you can correct me, but sometimes if you treat the headache with the wrong thing, a child can feel better for 12, 24 hours, and then the headache will rebound and it'll come back worse than it was the first time. Is that true, Dr. Stephenson?
Yeah. So in fact, if you try to acutely break the headache with a short-acting medication, you can absolutely provide relief. In a patient who is prone, like Lexi is, to prolonged headaches, then you do set up for a medication overuse or a rebound headache. And in that scenario, a different class of medications that we call the preventative medications are much more effective. Mm-hmm. And those are medications that you start at a low dose, gradually increase over a period of days to weeks, that begin to quiet the migraine generator in the brain.
Mm-hmm. I remember, back in the day, of course, I've been doing this 30 years, but when I first had migraines as a child, sort of the mainstay of treating them was narcotics. And I mean, that can be a very dangerous thing, of course. And, I never became addicted. But what I found over time is they made me sicker than they helped me. So do people do that anymore? Give narcotics for pain and migraine?
So really, no. The answer, there's no role for narcotics in the treatment of headache or migraine. And we know that the use of any sort of narcotic medication twice a week or more increases the chance of developing worsening headaches or medication overuse headaches. Mm-hmm. So the American Headache Society and all the guidelines are no narcotics for headache.
Okay. What causes migraine, Dr. Stephenson?
That's a great question. We are still trying to figure it out. Yeah. The clues are that it happens in women more than men, that it is a familial disorder. So there's often a first-degree relative or a long family history of migraine, is that migraine is not just pain. So it's not just you have light sensitivity, loud noise sensitivity, nausea, implicating lots of different areas of the brain. And there are some subtle imaging changes on MRI scans that occur in people who have had a lot of migraine. So we know that it's a neurologic condition. Our best theory is probably that it's an overexcitability of the nervous system, similar in some ways to epilepsy, where people have electrical seizures, in that there's something that primes the system and then triggers can activate an attack. And our job is then to figure out how to quiet the machine so those attacks happen less often.
Mm-hmm. Is there a vascular component? I mean, is there blood vessel spasm involved?
So that was a theory that was purported probably over the last 30 or 40 years. But what we know now is the vascular dilation, or the swelling of the blood vessels that seems to go along with your head feeling like it's pounding, is probably not the cause, but is just a secondary effect of the actual neurotransmitter changes in the brain.
Okay. But we don't know what stimulates the overactivity of the neurons in the brain. Is that correct?
We don't have a good understanding of that yet.
Okay, but we will, right?
Because
people like you and people like Keith have raised a lot of money to figure it out. So Keith was saying that they'd been through a lot of doctors, a lot of different treatments, a lot of treatments that are used for seizures. When you see a 11, 12, 13-year-old girl in your practice, Dr. Stephenson, coming in with, 100 days of migraine headache, where would you start as far as treating it?
Well, so first you have to make sure the diagnosis is correct. There are things and conditions that mimic migraine headache, so you make sure that her neurologic exam is pristine. There's no evidence of any swelling anywhere in the intracranial spaces, and that this diagnosis is consistent with what we would call chronic migraine, which is when you have headache more than half the days of the month, migraine headache more than half the days of the month for more than 3 months. When the diagnosis is certain, then really we go to first principles. And the first principles for migraine prevention and treatment are make sure kids are getting the right nutrition, hydration, sleep into their body. So we spent a lot of time with Lexi making sure she was drinking 60 to 80 ounces of fluid, getting 9 hours of sleep at night, exercising, getting her back into exercise, making sure she was eating the right kind of foods, no major elimination diets, but making sure she was eating breakfast, and then recognizing and managing the degree that stress was contributing to her symptoms. So all of those things we call our healthy habits, and all of them can make a huge difference in kids who have either chronic or episodic migraine.
Boy, those are lifestyle changes that we all should make. Now, Keith, how has your daughter's lifestyle changed? And I imagine you did it sort of gradually over a certain period of time. What different things has Lexi done and have you done with her to help change her lifestyle so that she minimizes the amount of migraines she gets?
Ironically, she did really well with the lifestyle changes. I think because if you're in pain and a smart doctor like Dr. Stephenson says, hey, if you do these things, it's going to help you get better. She really jumped to the lifestyle changes. I think the challenging thing for kids is always the drinking enough water, keeping them hydrated, and going to sleep in certain windows. We do know that certain foods do trigger Lexi's headaches because it triggers mom's headaches. So, things like bananas, things like packaged foods that had a lot of preservatives and MSG, we could see a correlation. So we immediately cut those out right away, and she jumped on the train very quickly, impressively. But of course, that's Lexi's style; she gets it done quick. So,
well, and I'll tell you the truth: when you're in pain, and some of the kids I've seen in the most pain are migraine sufferers. Dr. Stephenson, can you give us a list of foods that people who have migraines, kids who have migraines, should avoid? And then if there are other foods that actually help a migraine, what would those be? So first, what should kids avoid or parents have their kids avoid?
There's no standard list. Some people have sensitivities to certain foods. So again, we don't purport a total elimination diet, but we do ask people to track their headaches and see if there's a pattern where in the 12 hours prior to a headache onset, they may have had a certain food. And really, the main foods that are the worst offenders for being migraine triggers are mostly junk foods. So that would be foods that include MSG, so the typical being Chinese food. But MSG is also in lots of other products, so you have to read labels. A lot of those products are kind of brightly orange colored and probably shouldn't be eaten at all. Preservatives such as nitrates, which are used in a lot of smoked meats, salamis, pepperoni, they can trigger migraines. Certain cheeses, smoked cheddars and smoked cheeses can cause headaches. Chocolate has been known to be a trigger for headaches, which is really a sin. And I
agree. It's one of my favorite peanut M&Ms. Yeah.
Yep. Caffeine has been known to be a trigger. I mean, I've seen people be sensitive to yogurt, to chocolate milk, to bananas, but these are a little bit more rare. So there's, I wouldn't purport necessarily an elimination diet, but a healthy diet is good. And skipping meals can be as bad as actually as actually eating one of the triggers.
Yeah. So I think what I'm hearing you saying is you really need to do detective work with your kids and see, okay, what did that child eat 12 hours before a headache? And, what made it worse? I have seen even kids who chew sugar-free gum. It triggers a headache. I don't know if it's the chewing motion or it's the artificial preservatives, aspartame, whatever is in sugar-free gum. So you really have to do some detective work, I think, as a parent. Parents, I hope you're enjoying my conversation with Keith DiMarino and Dr. Donna Stephenson. We need to take a quick break, but don't go anywhere. We'll be right back with more of our conversation. With more than 70 sizes, including their signature half-cup sizes, Third Love designs bras with breast size and shape in mind for a perfect fit and premium feel. Just answer a few simple questions via Third Love's Fit Finder quiz to find your perfect fit in 60 seconds. Then, thanks to Third Love's 100% fit guarantee, you can wear, wash, and put your bra to the test for 60 days. And if you don't love it, you can return it, and Third Love will wash it and donate it to a woman in need. This is hands down the most comfortable bra you'll own, with straps that won't slip, tagless labels, and lightweight, super thin memory foam cups. I will tell you, ladies, I have worn Third Love bras, and there's nothing like them. You literally feel like you don't have a bra on. You don't feel any tags. You don't get any pinching. The bras don't feel too tight. And I know that just like me, if you give them a try, you will love them. Third Love knows there is a perfect bra for everyone. So right now, they're offering my listeners 15% off your first order. Go to thirdlove.com/Meg now to find your perfect fitting bra and get 15% off your first purchase. That's thirdlove.com/Meg for 15% off today. Are you dreaming of a beach vacation? Start planning your escape to Panama City Beach, Florida. Imagine spending your days doing the things you love, all in a setting of sugar white beaches and turquoise waters. Discover endless family fun, heart-pounding thrills, eco-adventure, and romance. Make it memorable. Get up close to dolphins in their natural habitat on a boat tour. Give paddleboarding a try, or just lounge under an umbrella. There's so much fun, it'll make your family's head spin. Make it exhilarating. Find your thrills flying on a jet ski, kayaking at sunset, or snorkeling in turquoise waters. It's everything an adrenaline junkie lives for. Make it incredible. Bike along the beach, take an airboat tour, or explore the secluded beauty of 2 state parks. PCB offers one eco-adventure after another. Make it special with a romantic getaway. Relax and reconnect with dining on the beach, breathtaking sunsets, and enough live music to dance the night away. So make it yours. Make it Panama City Beach, your real, fun beach. Plan your escape now at visitpanamacitybeach.com. Did you know 1 in 6 kids in the United States faces hunger? And that number goes up during the summer months when kids don't have access to school meal programs. Undeniably Dairy and America's dairy farmers have been passionate about providing food to families for a long time. And this summer, they're building on dairy's commitment to nourishing communities by partnering with Feeding America to fight child hunger. Dairy remains a simple, affordable source of many essential nutrients in a time when eating healthy only seems to get more complicated. And since 95% of dairy farms are family-owned, when you buy cheese, yogurt, or milk, you're supporting hard-working dairy farm families near you. In fact, most milk is made less than a 2-hour drive from where it's sold. Help get food to families who need it. Go to giveagallon.com to donate to a food bank in your community. Then, stay tuned at the end of this episode to hear about Carrie, who wasn't born into farming, but married into it and has become blessed because of it. What role does exercise play in reducing or preventing migraines, Dr. Stephenson?
It's huge, and exercise is such an important healthy habit for all medical conditions and for our health in general. But it increases your natural opiate activity in your brain and your endorphin system, and it actually allows your body to be able to handle stressors better. So we recommend at least 5 times a day of 30 minutes of exercise, 5 times a week. 30 minutes.
I was going to say exercise. 5 times a day.
Yeah, no.
5. Okay, so 5 times a week, 30 minutes at a time.
Yes, of running activity outside or whatever that you're getting your heart rate up.
Okay. And that will greatly reduce a child's chances of getting migraines? What if they already have a low-grade migraine and they go exercise? Will that help it or hurt it?
Well, it won't hurt it. So the important thing to know is if you have a migraine headache and something worsens your pain, it's not causing you any damage. It's not hurting you in any way other than increasing your pain. So my general rule of thumb is if you have a certain level of headache, say a 6 out of 10 headache, and you want to go out and take a walk, great. Go ahead and walk up to, your capability. And really, if your headache doesn't increase more than 2 points on that scale, you can probably continue it.
Okay. Keith, are you an exercise family, or did you just find you had to sort of do a lifestyle change to have your daughter exercise more? Or was she in pretty good shape before she got the migraines?
She was in pretty good shape before the migraines. And I think what also happened was with her sinus infection, she was laying around so much. And if you're an exerciser, you know that, your cardio kind of drops fast if you're not continuing to exercise. So I think her stamina got hit by that first issue. But mainly, we are an exercise family, and I think the hardest part for Alexa was that she had to exercise with a migraine. And I think as a parent, she would just do it. I'd say, we want to get 5, just like Dr. Stephenson said, 5 times a week, 30 minutes in, and she would have a migraine, and you'd have to say, well, let's go to the gym. And this little girl would go to the gym and to the treadmill and elliptical and pull-ups, and she would just do it with a migraine, which was really, really incredible, but also hard to watch.
I bet as a parent, having a child who has a lot of pain is terrible to watch. So let's talk about Lexi's success. So you went through these different medications, and then you eventually changed her diet and her lifestyle. What did you do to help reduce the stress in her life?
Well, I'd say the school that she was at was wonderful with helping. I think a lot of schools don't understand migraine or it's just a new thing for them and they might not know how to adapt to it. But Lexi's school was great because she didn't have to worry about the stress of trying to get caught up before the school year ended. They worked with her to accommodate to her situation. So that helped with stress. And then trying to just kind of keep a low stress environment at the house is hard. We have 4 kids. So with 3 little brothers, she's always getting.
Oh, there you go.
Someone's always in her face.
She's the oldest and only daughter of 3 little brothers. Yeah. There you go. Yeah, so well, that's good because I think that's really key. And with the lifestyle that a lot of kids live these days, where they're really overscheduled and pushed and they have no downtime, that must have been hard with a daughter, particularly one it sounds like she's a little driven and she likes to get, her exercise in. That must have been pretty hard for you.
Yep. Yeah, it was not easy, but she was very positive about it, and Mom and I tried to stay positive, which I think is a challenge. Yeah. Because she was really looking at a hard situation, and you want to have an environment that celebrates the small wins, and then we try and help her get through the hard times. Yeah.
Well, she's lucky to have parents like you. It was kind of a silly question. Is your family an athletic family? I mean, we just did the rim to rim to rim. That it really is an extreme athletic accomplishment. Dr. Stephenson, let's talk about treatment and preventative. I mean, we went through the diet. What kind of medications did you start Lexi on, and what do you find really helps these kids either preventing or treating a migraine?
So the foundation of the house is really those healthy habits, and they need to be in place concurrent to what we were doing with Lexi, which was trying different medications in a very structured way. So I break them down into medications that you can use acutely if your headache is particularly bad. And we know there are limits around how often you can use acute medications, again, not to run the risk of medication overuse. So we do, and not in Lexi's case necessarily, but we do start with the over-the-counter medications like ibuprofen, like acetaminophen, like naproxen. And then there are a class of medications called the triptan medications, which are migraine migraine-specific abortive medications that you take at the onset of a migraine attack that have a very good success rate in children and are well tolerated. And then we have a handful of other medications that we use that are completely off-label for migraine that help with nausea and help with some of the other symptoms. So that would be things like the gastric motility agents like metoclopramide, which has some anti-headache effects, and ondansetron, which is an anti-nausea medication. We use those in conjunction with some of the triptan medications. But again, we do avoid the narcotics. They just don't seem to be helpful in the long term.
Right.
So then for the preventative medications, we have extrapolated a lot of what we use in pediatrics from what adults have used. So there's tons of studies in adults with migraine. The incidence of migraine in adulthood is 18% of women and 6% of men. 3% of those migraineurs have chronic headaches. So people have been using preventative medications for decades. There are many, many fewer studies demonstrating both the effectiveness and the safety of medications in children. But as a headache specialist, we do what we can. So the two main medications that we use for prevention of headaches would be topiramate and would be amitriptyline. They're in two different classes of medications. They're both safe and well tolerated. And then we have a handful of other medications, from the beta blocker medications to the calcium channel blocker medications that we use as a trial, usually for about 6 to 12 weeks, to see if we can cut down and to reduce the frequency and severity of headache.
What are the main side effects of the medications you just mentioned, the beta blockers, amitriptyline, topiramate? What are, because those are fairly commonly used, what are the side effects?
So they're all a little bit different because they're all in different classes, but the commonality is that they're all brain active medications, and they can all make you sleepy or lethargic. And so that's not ideal. I mean, you could get your headaches under control, but if you're not feeling like yourself or very tired, that's not ideal. Topamax itself has some other rare side effects, such as kidney stones, which are super rare, paresthesias in your fingers, decreased sweating, higher risk of heat exhaustion, and some brain fog. But those are thankfully very rare at the doses that we use. And amitriptyline, really, besides making you tired and dizzy, are the two most common side effects, might lead to some dry mouth and constipation.
And you don't worry about cardiac events with amitriptyline at all?
So amitriptyline can prolong an interval on your EKG, the QT interval. We always standardly screen for an abnormality of the QT interval before we start amitriptyline, and then if we're going to maintain someone on amitriptyline for more than 6 weeks.
Okay. Now, Keith, your daughter Lexi, the medications that you mentioned she was on, you said Depakote. What else was she tried on also? The
amitriptyline she was on when
I think
before she came to me, and she had trialed the topiramate prior to that. And then we did switch her. I think in the process when I started seeing her, she switched from amitriptyline to its cousin nortriptyline, which for some people is more effective. And she's also on propranolol at the moment, and that seems to give an additional layer. So right now, not ideally, she's on 2 medications that she takes daily, but my hope is that these will become less and less necessary for her.
What is her outlook like as an adult and migraines? Do you anticipate these will lessen? Will they increase? Will they be with her for life?
That's a great question. I mean, we've not yet been able to find a cure for migraine, which is certainly a goal. But the majority of patients who have migraine, whether it be episodic or chronic, can learn to manage and control their symptoms largely through trigger avoidance, through the healthy habits. And then I think of people having a toolbox when they have migraine, so that when they do get a migraine, they have an effective tool that works quickly and totally to eradicate their headache. So my goal is to give her that toolbox and make sure her tools are effective.
So basically, you said ibuprofen, triptans, metoclopramide, and anti-nausea medications. Has there ever been a time when those don't bring a migraine under control?
Absolutely. And then we reach for even stronger tools. So very rarely we use things like sedatives, muscle relaxers, anything we can do to get a child to go to sleep. Because I think of sleep as like the angel of migraine. It'll come around and bop you on the nose and let you get to sleep. And sleep usually gives you relief. So.
Right. Yeah, because it's hard to sleep if you have a bad migraine.
Right.
Talk about, and I'm going to go back to Keith for a minute, talk about the newer medications that are coming out that I don't know if they're using them in kids, but the once a month medications that are relatively new. Are you using any of those in
Dr.
kids?
Meeker, this is very exciting stuff, so I'm glad you asked. So this is the first novel treatment we've had for migraine headache in the last 20 years. Now, these are injectable biologic agents. They're not even medications. They are antibodies. One antibody is against a receptor in your brain to this molecule called CRGP, I get them backwards all the time, calcitonin gene-related product, is a molecule that we know gets released and is elevated in your bloodstream during migraine attacks. So the theory is to block the receptor for this little molecule or to block those molecules itself and tell the migraine just to shut up. And they seem to be very effective. You inject them under your skin once a month, and they cut down, for most people, your migraine frequency and severity. I think it's in 70% of people. For most, they've reduced by 50% of their attacks. So this is data that is all in adults over 18. We are beginning to use these biologic agents in children. We're always a little hesitant to jump right in and do everything in children that we would do in adults. And studies are being developed and ongoing for kids, but very exciting stuff.
Unfortunately, they're very expensive, but I was wondering they're very expensive, but if you were beginning to use them in kids. So Keith, how is Lexi now? Out of a month, how many migraines do you think she has?
Lexi got through that situation last year, and then for the rest of the summer, she really had maybe a few, 2 or 3 migraines over the course of 3 months. Since then, that last fall and the winter, she was completely migraine-free. I think she might have had some triggers here and there that was more considered like a headache, but not necessarily migraine. And then recently we've had a challenge. Let me reverse back to that. So she was migraine-free most of the winter, and she was off the medicine completely, pretty much, I think, in the last 3 months.
Wow.
She recently got caught into a migraine again, and so she's dealing with some of this right now. Thankfully, we've been able to move more quickly with the medicine since we know what medicine works. And she's seeing a little relief right now, but she's had one actually recently for about the last 30 days, which is tough for her, but showing some improvement currently.
Yeah, that's hard. We only have a couple minutes left, and I have to ask this question, Dr. Stephenson, because I get it asked all the time. And gluten-free diets are very popular. And is there a role for the gluten-free diet in migraine prevention?
I don't think that there is a role for any elimination diet unless there's a clear trigger. So if someone were to eat gluten and consistently get an attack or have a lot of gluten, then I would think that's a reasonable food sensitivity. I mean, celiac disease being a real disease where you have an allergy is one thing, but even that is not a known migraine trigger.
Yes.
So we don't propose that anyone is on any particular elimination diet without good reason.
Well, I'm glad to hear you say that, because a lot of people, when their kids are experiencing any kind of pain or allergy, start really severely restricting what their kids are eating. And, that can do them more harm than good. And finally, Dr. Stephenson, do you think there's an allergic component to migraine? I know you say, stay away from foods that begin to trigger it. Do you think that's because there's an allergic component there?
I think there's a sensitivity. So again, the nitrates we know can actually cause dilation of the blood vessels that mimic a migraine and can probably trigger a migraine, but it's not a true allergy. Mm-hmm. Same thing with other triggers. They lead to some chemical reaction in the brain. Yeah.
Wonderful. Well, Keith, do you have final thoughts for the parent who's sitting out there listening thinking, my child gets a lot of headaches and I don't know where to start. And I went to my pediatrician and they kind of said, well, just use Tylenol. What would you say to the parent who thinks, gee whiz, I think my child's headaches are not the norm?
I would say a couple things. One, is to be an aggressive advocate for your child. If it's not working and you don't feel the treatment is working with the current physician, seek other options. There's lots of options out there, and work quickly because, it's a hard thing to have to live with as a kid. I would also add that the relationship with your child is really important in these situations. So you really need to embrace your child, strengthen the relationship you have with him or her, try and understand in their mind this is a really big event and it's a lot of pain and you can't avoid it. So I would pay extra attention and give that child the support, because they're going to need the positive reinforcement and they're going to need someone to work on their behalf as their advocate, so that there's a good amount of hope and progress can be made. Otherwise, it's a hard thing to go through alone. So you want to do it as a family and you want to do it with a strong relationship. And on the other side of this, I think it'll bring the parent and the child much closer, when we find a solution for that.
Yeah, those are great points. And I thank you for that. And I think that being an advocate is very, very important. And if your pediatrician doesn't give you clear diagnosis or treatment plan, a good pediatrician will find out what doctor can give you the answer. So you need to just, push for that. So, well, Dr. Stephenson and Keith DiMarino, thank you so much for joining us. I know we've never done a show on migraines, and this is just a critically important one, because there are a whole lot of kids out there with headaches, and it's important to know for parents, how to begin the process of figuring out if there's migraine or what to do if their child does have one. So thank you both so much for joining me today.
You're welcome.
It was a pleasure. Great, thanks.
And now on to my points to ponder. First, migraine headaches don't always present or appear with the typical symptoms that many of us have come to believe. Historically, physicians and patients were told that classic migraine headaches had the following symptoms: seeing dark or bright spots, throbbing headache behind the eyes, sensitivity to light, and nausea or vomiting. Now we know that migraines can be any headache that is severe in symptoms. Migraines can be debilitating, and parents must remember this. Often, if parents don't experience bad headaches themselves, but their kids do, parents tend to downplay the seriousness and severity of the headache. As a current migraine sufferer myself, please don't do this. Bad migraines can keep a child from being able to concentrate at school, sports, and interfere with their enjoyment of life. Second, if your child has recurring headaches, have her evaluated. Often parents tend to minimize headaches in their kids, but if your child has them repeatedly, please take her to your pediatrician. He or she will give her a full evaluation to determine which type of headache your child has. Headaches are due to many problems. Some are not very serious, but some can be life-threatening. So make sure that your child has a good examination and questioning from her doctor. Third, migraines are treatable. It's important to remember that most migraines can be managed with different medications. In addition to medicines, there are lifestyle and dietary changes that can help as well. But before any of these are implemented, it's important to have a proper evaluation and diagnosis. If the first changes that you help your child make don't help, don't get discouraged. There are many different medications and strategies that physicians can use to control them. All right, parents, let's get social. I want to hear from you and interact with you. You can connect with me on Facebook, Twitter, and Instagram at Meg Meeker MD. Or if you have a question, send it to askmeg@megmeekermd.com. I try my very best to answer as many questions as I possibly can. Our first question comes from Kim. Dear Dr. Meeker, I'm a parent of 3 kids, a girl 17, boy 16, and a boy 11. I've always thought of myself as an authoritative parent, but lately I find myself mostly with my daughter flip-flopping between authoritarian and permissive. She's angry and doesn't want anything to do with me, unless I need to pay for something. She's extremely good at talking me into things and manipulating me. She regularly lies to get what she wants. Despite my very best effort to teach her the values of faith, honesty, people before things, and work ethic, she's very materialistic and often puts fun, looks, and possessions above these values. In January, I found birth control pills in her purse, which she got at Planned Parenthood. This is contrary to our Catholic family values. Her boyfriend broke up with her shortly after I discovered the pills, but they're now back together. While my boys struggle with impulse control, media obsession or addiction, and lying, with them I can issue consequences, and after they calm down, have loving conversations about why these are unhealthy behaviors. My daughter either will not speak to me about these things or tells me what I want to hear so she can get what she wants. When my husband gets involved in discipline, she says he's only saying that because of me. She also has a good deal of moral relativism and blames my rules and chore expectations on her disagreement with my values. While I know this is not true, I do know that 17-year-old girls who act this way don't feel loved or have self-esteem. I have failed her in a big way. She also told me she hated it when I praised and thanked her because she was doing a good job or what I asked. When I took her on a trip to look at colleges, she put earphones in and either listened to music or was on social media. When I asked her to put it down and talk to me, she went to sleep. She told me that her friends still like to go to movies and do things with their moms. I told her I would very much like to do things with her. She said she doesn't even want to be around me because of the way I am. Please help. Well, first of all, Kim, let me tell you what I am gleaning from your question. First of all, your daughter is running ripshod all over you. You say she's manipulative, and she is. My question for you is, why are you taking the bait? Any 16-year-old will be manipulative as long as they can until someone says, stop it, I won't bite. So first of all, you need to toughen up. Your daughter is really acting like a brat, and she's very self-centered, and she's running all over you. So you need to get some steel in your spine and tell her to knock it off. Second, I hear you really criticizing and condemning yourself, but not necessarily your daughter. When you do this, you're communicating to your daughter that everything she's doing is your fault. Listen to me. It is not. She's making these decisions and acting out because she's allowed to. And she realizes that she can take advantage of you, do whatever she wants, and all that's going to happen is you're going to be nice to her. Third, your approach to parenting is this. If I'm nice enough and encouraging enough and loving enough to my daughter, then she will become a good person. Well, that's only half the story. Remember, parenting well is about balance. It's fine to encourage your daughter and to be loving and to pay her compliments. However, if you don't balance that with rules, boundaries, and some healthy discipline, she won't respect you. Your daughter doesn't respect you. And that's because you don't respect yourself and you're losing balance in your parenting. So I encourage you to step into your authority, to understand that you're the boss and she's a little kid, to not take the bait when she tells you that you're to blame for the chores and the rules that you're setting because you're not. You need to give this little girl some pushback. I also encourage you to tell your husband to get on board with you. She's manipulating him as well. And I think that one of the reasons she doesn't respect you in your home is because she sees you as weak. And she sees you as loving and kind, but she feels like she can get away with whatever she wants in the house. So both you and your husband need to be on the same page. You need to set some rules, and you need to start treating her like you treat her brothers. Parents, you know I love answering your questions, so keep sending them in to me. You can email me any parenting question to askmeg@megmeekermd.com. Again, askmeg@megmeekermd.com. I want to thank my guests, Keith DiMarino and Dr. Donna Stephenson. To find out how you can help in the fight to raise awareness for migraine headaches, you can go to CHOPDonorDrive.com and type in MILES, M-I-L-E-S, against migraines in the search bar. Once again, that's chop.donordrive.com and type in MILES against migraines in the search bar. Now let's recap my points to ponder. 1, migraine headaches don't always appear with typical symptoms that many of us have come to believe. 2, if your child has recurring headaches, have her evaluated. And 3, migraines are treatable. It's important to remember that most migraines can be managed with different medications and lifestyle changes. So until next time, parents, always remember that great kids are raised, not born.
Hey, this is Bobby, producer of Meg Meeker's Parenting Great Kids podcast. Thanks for listening, and because of your dedication to raising great kids, Dr. Meg's Parenting Revolution has grown to over 3 million downloads. Head on over to Facebook and Twitter and follow @MegMeekerMD and check out what's new at megmeeker.com. And while you're there, sign up for the newsletter to stay updated and get information about giveaways. Don't forget to share the podcast with other parents, subscribe so you won't miss anything, and leave us a review so we know how we're doing.
For Carrie, raising her family on a dairy farm is a unique blessing.
So my older boy helps is in quotation marks. He's around, he's really great. If you need a hole dug, he is on it. If you need calf grain scattered everywhere but in the pails for the calves, he is your man. I'm Carrie Mess, and it's mess like make a mess. Everyone calls me Dairy Carrie. I live in Wisconsin. I'm a dairy farmer.
Life on the farm is one many folks are born into, but Carrie had a less traditional route. She married into a dairy family, but even that wasn't enough to get her into farm life. She had to take matters into her own hands.
So my husband, he had a job in town. He wasn't the kid that always planned on coming back. After we got married, so I was like, maybe I should try dairy farming. And we went to his parents and we were like, okay, will you please hire me? And they're like, not really, no. And so I quit my job and forced the issue and just kind of started showing up and milking cows. And fortunately for everyone, mostly for the cows, I really found my passion. I love what I do. I love taking care of cows. I love taking care of the land. This is what I was meant to do, 100%.
And as a farmer, she also gets to supply families quality, nutritious food through the dairy she produces. That's something Carrie is particularly passionate about because she knows what it's like to grow up with food insecurity.
I actually grew up in the city in Madison, and I grew up in a house with a single mom, and we didn't always have everything we would have liked to have. So as an adult, having a real interest in food insecurity has been driven by my own personal experience. Things were tight a lot as a kid, and having that perspective as somebody who wasn't always 100% food secure really sticks in my mind. So, I talk about farmers being providers. For me personally, it is really important to continue to push in any way, shape, or form that I can to help others not be in that position. So, 1 in 6 kids right now are food insecure. It's really important to me to try to get that number to 0.
Undeniably Dairy is teaming up with Feeding America this summer to help give food banks the dairy products they need to nourish the communities they serve. Just go to giveagallon.com and donate today. Giveagallon.com.
Anybody that's listening to this that really wants to get involved, hopefully you're moved by hearing the story of a dairy farmer who didn't always grow up food secure. You're moved to do something because we really do need more people involved. You can go check out giveagallon.com and be part of this movement.